All right, the endocrine system, we're picking up with the thyroid gland on page 328. So your thyroid gland is right here in your neck. It's above the bone, so above that notch where your rib cage, is all starting, your sternum is starting. So it's right up here. And we have the parathyroids that sit on it, like 4 little dots there, which we'll talk about the parathyroids in a minute because they do something completely different. But the parathyroids are on the back side. When you look at the front side of the thyroid, you do not see the parathyroids. They're on the back side, okay? But they're there, okay? So, thyroid. The thyroid puts out 2 thyroid hormones plus calcitonin, okay? We'll talk about what those 2 thyroid hormones are in a minute. They're called T3 and T4, but they have longer names. They're not that long. And then calcitonin. Okay. All right. T3 is called triiodothyronine, and T4 is called thyroxine. Okay. Both of them are made up of iodine. However, T4 has 4 atoms, and the T3 has 3 atoms. That's why they're called T3, T4. It's how many atoms of iodine. So when I look at the word triiodothyronine, I see tri, which means 3, and I see iodo, which I think of iodine. Okay? So word association really helps. Obviously, the tri meaning 3, so thyroxine must be the other one. Okay? And then iodine, because we're going to talk about iodine here in a minute. So T3 and T4 almost have like this same function. They are both, in order for these hormones to function properly, your diet must contain enough iodine. If you are not consuming iodine, you will have thyroid problems. And this used to be a very common problem in our country. We've gotten rid of it because iodized. Can you think of anything that you eat regularly that is sold as iodized? Iodized salt. We put it in our salt supply. And most Americans have no problem eating enough salt in a day. So if you are consuming enough salt, you are getting enough iodine because we've put it into the salt supply. That way, when we talk a minute about the goiters, we don't get those anymore because of we're getting enough iodine. But that used to be a problem in our country. We'll talk about that in a minute. And so T3 and T4 stimulate the release of energy from our nutrients, which means they make us metabolize our food. So we'll hear people say, I have a really high metabolism. I have a really low metabolism. This is really influencing the use of energy from our food and will definitely affect our weight. Okay, so these are some of the hormones that control those things. Hyperthyroidism, too much, increases your metabolism, and these are people who always say, I can't gain weight. And while I certainly do not understand that condition, I know people who have that have struggled with their weight on the low end just as much as people on the heavy end. Okay, they usually have big appetites because they're using a lot of energy, and they usually have a lot of nervous energy where they just kind of never can sit still. Okay. Couple of conditions if you have an overactive thyroid. This is a condition called exophthalmos. If we break that apart with med term, X is out, ophthalmo means eye. And so it's kind of like a bug eye, okay, where your eyes are protruding outward. Okay, that is a classic sign of Graves' disease, which is an autoimmune disorder. What's it say beyond that? And affects women much more frequently than men. Okay, so that's overactive thyroid. Hypothyroidism is low active thyroid, so under secretion, and not getting enough iodine can cause this. And this is a goiter. It's kind of like a really enlarged thyroid right here in your neck. It just kind of lumps out, and that's called a goiter. And that's what we don't really see a whole lot in our country anymore because we get enough iodine through our salt. Cretinism and myxedema are both conditions of having low thyroid. If this is during your growing years, they use the word formative years. They're talking like your growing years, your puberty years. It can slow your development, and it can actually cause some mental retardation going on there. Okay. If this is late in life, the condition is called myxedema. And this one is, again, impairing your cognitive function, your mental strength. It can cause weight gain, loss of hair, etc. And here is a picture of someone with that myxedema condition. Okay. All right, the last hormone coming from our thyroid is called calcitonin. Calcitonin's job is to decrease calcium in your blood. So if you take a calcium supplement, and let's say you take a lot of calcium, you eat a lot of dairy, wherever you're getting your calcium from, you eat a lot of it. You've got lots of calcium building up in your blood. Calcitonin maintains homeostasis by saying, get it out of the blood. It will store it in your bones. Okay. So as you consume a lot of calcium, your bones will then contain a lot of calcium. Now, we need calcium in our blood. It's very important. Your muscles can't move without calcium. So it's not going to get rid of all the calcium. Remember that homeostasis. There's a level it wants it at. And if you eat too much, we want to bring it back to that level. Well, what happens if you don't eat enough? You don't eat enough calcium, and our calcium levels drop. Remember, we got that storage sitting in our bones, right? So we can go to our bones and say, we need this, and put it back into our blood. And that is what the parathyroid hormone does. It increases the calcium in our blood. So when you aren't eating enough, or you're perhaps, maybe you're like a runner and you're using lots of energy, lots of muscle movement all the time, you run marathons, you need a lot of calcium to keep that up. And if you aren't maintaining the levels you need, your body's going to get it from your bones. Okay? So calcitonin and parathyroid hormone are the opposite of each other. One increases the calcium, one decreases the calcium. Okay? So they're partners in their job of keeping your calcium at the right level, that homeostasis of your calcium. Stop the video here, and we'll continue on with the next organ.